In the past, for lumbar canal stenosis, a surgery called lumbar laminectomy was performed. In the lumbar laminectomy, we take off the posterior arch of the lumbar vertebra and release the nerves. However, over the past few decades, minimal access surgery has been more and more popular among the people. In minimal access surgery, we don't remove the posterior arch. Once posterior arch is removed, after surgery, there's no bony structure for the muscles to get attached. And as a result, you can understand the stability of the spine can get affected and can lead to some problems in the future. However, in minimal access surgery, we go through the muscles and make a small hole in the bony structure, and either using an endoscope or a microscope, we go into the spinal canal and release all the tissues. Once it is done, we close the surgical wound and the patient will have a very small cut with very minimal tissue damage, and we can release all the pressure areas in the lumbar spine with that tiny hole. When we are doing a disc surgery, anyway, we are doing it using a microscope or endoscope, and the access will be minimal. The minimal access surgery has revolutionized the recovery period of these patients, either in disc surgeries or in lumbar canal stenosis surgeries. This surgery takes about half an hour and the patient recovers quickly, and the blood loss will be almost negligible in any patient. Therefore, patients with renal diseases or diabetes or heart failure or heart disease can undergo this surgery and have a good quality of life by having normal life without any pain down the leg and walking. So this is very important to understand why we introduce minimal access surgery in the lumbar canal stenosis and treatment. Not only in lumbar canal decompression, we will be discussing about lumbar fusion that we can do in minimal access surgery in a future program. Therefore, the patients have a good system or a good technique where we can operate and quickly patients can go home because the tissue damage is less. And the pain relief is easy because the tissue damage is less. And the recovery is faster because the tissue damage is easy. Therefore, it is very, very important and patient-friendly surgery for this complicated and ongoing chronic problem that makes patients disabled and make the patients to withdraw from their normal activities due to the pain.